Hi everyone, I'm Steve from Sculpt and Training. Nice to see you all again. I want to do a quick video for you on the update of the CPR protocol during the Covid-19 situation. Scares a lot of people what's going on with Covid and the risk for it, but there has been a change to the adult protocol. There hasn't been a change to the child protocol. We still would have done what you would have been taught on your original courses, opening the airway, checking breathing in a normal manner. That's changed when it comes to an adult, when it comes to Covid. The reason the child is still the same is because the child has a lot less oxygen in their bloodstream, and it's paramount we get more air into a child, which is more important than it is for an adult. It's estimated that a child has between 1 and 2 minutes of oxygen in a blood supply, an adult has between 4 and 7 minutes. So there's quite a bit more in there. So from that point of view, it's more paramount that we do our breathing when it comes to a child. So I'm going to quickly run through you the changes to the adult protocol. So same as before, we still go around and check our danger. Is it okay for us to approach? That's what we're going to do. Ideally, we'd wear a face mask when doing this, but obviously it's more difficult to teach wearing a face mask and demonstrate what we're going to do and ensure that you can hear me. So for this video, I won't wear a face mask. Once I've done that, the next thing we need to do is look at how do I get a response out of my casualty. So with this one here, what we do now is I'm just going to take my top off. And what we'll do, if we do anything else now, is we cover the mouth and nose. Because COVID is a droplet-based condition, an illness that can be passed, what we want to do is try and reduce any droplets coming out of the casualty's mouth that are less likely to cause myself or anyone that might be around helping me or assisting me from potentially catching COVID. So the next thing I've done is that. So I need to get my response. So I can still see my client. Hello, can you hear me? I can still do my gentle tap, my shake to see if I get my response. Then it's obviously my classic shout for help, help, can anybody come and help me? Hopefully somebody's come running, but there may be no one around. There might actually be people around that I can call upon. So these are things that I would need to think about and consider from there. And then obviously from here, the challenge comes now is more breathing. Normally, we would have tilted the head back, look, listen and feel down the chest, checking for breathing. But now that's difficult because of the risk of COVID. I don't want to get too close. So for here, I've got to look for signs of life. What's the colour like? Is my casualty a normal colour like we are? Or have they gone grey? Have they gone purple in colour? That might give me an indication. Can I see signs that the chest is going up and down? That might be signs showing me that the person might be breathing normally. If I'm struggling, I might put my hands on the casualty's chest. Do I feel any movement? Just lightly, so I'm not restricting any movement. That might give me some indication whether or not that person is breathing or not. Remember, we're looking for the signs of breathing normally. So if I'm hearing grunting, snoring, chain stoking, snorting, extreme gasping, very laboured breathing, that to me would say they're breathing abnormally. And I would need to go and look at doing some CPR for the individual. Now I'll quickly talk through the adult CPR protocol for you. I'm not going to demonstrate it. It is going to our hands-only CPR. So no need for providing rescue breaths because of the risk of COVID. But if you're dealing with a child, we would do our rescue breaths, then into our compressions, back to rescue breaths, compressions for that child, because obviously oxygen is a paramount thing we're going in the system. So that's all I wanted to quickly cover for you on changes to the CPR protocol for the primary survey leading into potential CPR for someone who you may suspect COVID is having COVID. So I hope you enjoyed it, found it useful. Feel free to subscribe to my channel. Feel free to write a comment and get in touch if you need some training. Okay? Thank you for watching.